So I'm sure in this process, you found out more nuances about medicine that was not so pretty, and things about the harm it can bring to people.
Absolutely. I mean, we know that some people say the third leading cause of death, it's inarguably in the top 10 causes of death, are not just medication errors, but just simply known side effects of medications. I mean, it's horrifying when you really think about it. You simply do not know how your body will fully respond when initiating a medication, which is why we as pharmacists are constantly talking about start low and go slow. So start with the lowest possible dose and slowly increase. And there's also a concept in medicine where you push past the effect that you actually need and then pull back, pull back, pull back, pull back. And that pulling back can almost get you to a better dose than like pushing, pushing, pushing. And then, oh no, we've got side effects. You know, that side effect is talking to you and saying, we've got to back down. And the catch 22 in modern medicine is that we have a very industrialized approach. We have a very guidelines based approach where even when I see a patient in telehealth practice, if I am saying to them, if they're coming to me and saying, look, I don't want to start a statin medicine, or I don't want to start metformin, or I just really don't want to have to be on this Synthroid for my thyroid. If I'm giving advice saying, hey, go back and I want you to try these things to repair these underlying dysfunctions in the body, because the body is not diseased. The body simply has dysfunction. And we just need to find the root of that dysfunction and give our body what it needs to fix it. You know, in functional medicine, there's only 8 root causes of disease. There's only 8 root causes of disease: stress, toxins and toxicants, allergens, antigens, and adverse food reactions. Then we get into the infections and infestations. This is also where dysbiosis lies. Then we have nutrient excess, AKA eating the standard American diet, and nutrient deficiencies, eating the standard American diet, which is devoid of all nutrients. And then we get into sleep, sedentarism or lack of exercise, and then sociogenomics, where you were born, who your parents were, how you were raised, the whole nature versus nurture fits into that. So, listeners, you can remember that just by remembering the acronym STAINS. If
Mm.
it's not one of those things, it's really not anything. So we need to identify the underlying dysfunction that's leading to the symptom instead of what modern medicine does very well, which is they say, well, we're going to name this problem, blame it for what's going on, and then we're going to tame it using a drug or a surgery. We're going to just throw a band aid at it when it's really like, you know, somebody asked me today, they're like, my irritable bowel syndrome, what do I do? What do I do? And I was like, friend, I'm saying this with all love and all kindness and all respect. Irritable bowel syndrome is anxiety. You're just calling it by a different name. So let's get back to the basics. Sleep and stress. How do we help with anxiety? How do we minimize these things? Of course, we got to work on our nutrient excesses. If you've got irritable bowel syndrome and you're still continuing to eat dairy and gluten all day, of course, you're going to continue to have problems. So
Mhm.
we really want to look at what is the dysfunction that we're actually trying to treat, because medications do cause a very serious set of side effects, including microbiome disruption, nutrient depletions, and there's also just really good evidence that drug research is manipulated in a lot of ways.